Hello, my name is Dr. Haley Bento, and I'm here today to present a video abstract for a recently published article in the Journal of Cardiopulmonary Physical Therapy titled Reducing Upper Extremity Precautions After Lung Transplant, the Clamshell Protocol Pilot Study. This is authored by myself as well as my colleagues Dr. Deborah, Maxwell Hunter, Bryan Lohse, Zhining, Angela Presson, and Margaret French. If you haven't already, make sure to go ahead and read the protocol paper that was the precursor to this study, entitled The Clamshell Protocol, Rewriting the Rules After Lung Transplant. This will give you a great overview of how we created the protocol that we then studied in this pilot study. For this pilot study, we are going to study the less restrictive clamshell protocol for post-surgical upper extremity movement following lung transplant. We used this protocol and implemented it as a new standard of care rather than the standard sternal precaution protocol. The purpose of this pilot study is to assess the safety of transitioning from that sternal precaution protocol to the clamshell protocol. This was a single-site, observational, quasi-experimental study at an academic medical center that occurred from March 1st, 2021 to February 28th, 2023, so a 2-year period. The clamshell protocol was implemented the halfway point, March 1st, 2022. The cohorts for this study were then determined based on the protocol in place at the time of lung transplant. So the sternal precaution was in place during that 2021 to 2022 period, and the new clamshell precaution was put in place from 2022 to 2023 and going forward. Safety is described by the frequency of adverse events, which were described as sternal instability or chronic surgical wound infection within 6 months of surgery. Summary statistics were reported, and adverse events were reported with 95% confidence intervals. Demographics and clinical characteristics were similar between the cohorts. Adverse events occurred in 4 patients, which was 10%, including 3 patients in the sternal precaution protocol and only 1 patient in the clamshell precaution cohort. Those with adverse events tended to be older with higher body mass index and comorbidity index scores as compared to those that did not have adverse events. So in this pilot study of reducing upper extremity restrictions after lung transplant, there is preliminary evidence of lower adverse events, suggesting that reduced restrictions may be a safe alternative to the current standard of care. The results of this pilot study provide preliminary support for this new clamshell protocol. However, because this was a pilot study, we had small sample sizes. Further studies are needed to confirm. That's all we have for you today. We hope you go enjoy this article. Thank you.